So online, lots of information and lots of misinformation, right? And how do you know which is which? And how do you know how to navigate all of the overwhelming amount of information that's online when you type in tinnitus or you type in sound sensitivity? So there's many different treatment options, which is a positive, but it can become very overwhelming very quickly, especially if you're in that acute phase where tinnitus has just started and you're feeling, overwhelmed by all of it. So just listing a few here: tinnitus retraining therapy. Dr. Jastoboff, I know, is going to be talking later, which is fantastic. Progressive tinnitus management was developed by the VA, over-the-counter supplements, acupuncture, cognitive behavioral therapy, which has been mentioned several times as well, prescription medications, and then a whole host of a bunch of other things. That could be an entire 20-page slide on all the different things that you'll find online. So what actually works right now? We created our treatment program. I think it's important to have a framework. And even in my previous clinic before I joined Treble Health, it is helpful for both, I think, the provider and the patient. So it provides sort of a comprehensive and insightful framework for patients with tinnitus or sound sensitivity to identify which areas should be a focus of the treatment plan or the therapy plan, and which areas, we don't need to sort of prioritize or make a primary focus at the start of treatment. So I think this framework helps to make the treatment implementation more streamlined. It helps to make it more strategic in navigating and driving that steady progress towards habituation, which is the ultimate goal, getting patients back to their lives. So by breaking it down into these smaller areas, it becomes less overwhelming for the patient themselves. It feels like more manageable. You can break it down into these smaller steps, build upon that foundation, layer these skills and these tools on based on the different areas of focus. So the four pillars: sound is obviously one of them, sleep, stress reduction, and then somatosensory.
This is a short interruption from today's video to announce the tinnitus quiz. If you're watching this video, there's a good chance that you or someone you know has tinnitus. We know how much tinnitus can impact your daily life, and we're here to help. Visit tinnitusquiz.com and take a 2-minute quiz to receive personalized treatment plans that have helped hundreds of people learn to manage their tinnitus. Start now at tinnitusquiz.com.
So the first one, and the one that's going to be the most obvious, is sound. But when I say sound as a primary pillar for tinnitus treatment, we're talking about more than just the tinnitus itself. So obviously the tinnitus, when I work with a patient, the specific characteristics, like I said, it's like our fingerprint, the tinnitus, the pitch, the loudness, the quality, the characteristics. Are there multiple sounds? Does it change in locality of where people are hearing it or feeling it even sometimes, right? So getting the details on that helps to sort of give us insight, because we can't hear what you hear. So the more detail we have on that, I think that helps in creating sort of that customized sound therapy program. And sound therapy itself is very different. This term is thrown around a lot, and sound therapy is not just throwing sound on in the background and good luck, right? A sound therapy program has a protocol, it has guidelines, it has parameters, it has, what specific customized sound or combination of sounds might work for someone. Some people love white noise, some people do not love white noise. So how do you create and customize the particular type of sound that a patient is going to find relaxing and soothing and actually helps with giving them some relief from their tinnitus? How many hours a day? What do you do when you're turning your sound therapy off? What additional type of sound therapy can you have in terms of acoustic enrichment or sound enrichment to help supplement the customized sound therapy? There's a lot that goes into it. And I think that that's often misrepresented a little bit in terms of when you read about, what sound therapy actually is. Then in addition to the tinnitus sound therapy itself, we're also talking about sound sensitivity. So you'll see the terms sort of decreased sound tolerance, you'll see hyperacusis, you'll see misophonia, which has to do with the dislike or sensitivity to more specific sounds. Research shows that 30 to 50% of individuals who report bothersome tinnitus also report sound sensitivity issues. Now, if a patient reports that hypersensitivity or hyperacusis is the primary issue, the sound therapy protocol and program is very different than someone whose primary issue is tinnitus. And typically we want to address the sound sensitivity first, because we want to really sort of strengthen the auditory system's ability to tolerate normal levels of sound in order to then focus on the tinnitus retraining piece of it. So a very important information to kind of gather in those initial couple of sessions with a patient to be able to, again, sort of frame out what areas you're going to focus on and in which order you're going to do it. There's a strategy behind it. Additionally, we're talking about fear of sound, which is also known as or referred to as phonophobia. So a lot of people that we work with, there's this underlying sort of concern or worry about, as you're getting better, like going back into the world, right? What's safe? What's a safe level of sound? What's potentially damaging? I don't want to do anything that's going to make my tinnitus or sound sensitivity worse. How do I know if I should be wearing my earplugs? How do I know if I'm overusing my earplugs? All of those questions create a feeling of uncertainty and increase anxiety. And so breaking that down, giving, sort of the answers, giving the education, empowering patients to feel like they have the knowledge base and the understanding and the tools to feel like they have a sense of control regarding kind of sound exposure, noise exposure, being in different acoustic environments. It's all part of that first pillar of sound. The second pillar is sleep, which we know is a huge contributing factor to the exacerbation of tinnitus and sound sensitivity. Research shows about 54% of patients with tinnitus also report sleep issues or insomnia. Not all, but a majority, or more than half of the population of tinnitus patients report some sleep issues. Now, some people had a history of sleep issues or insomnia prior to the onset of tinnitus, and some patients will say that those sleep issues didn't start until after or post tinnitus onset. Regardless, you have to address that first. Sleep, I think Dr. DeRitter talked about it. I think a couple of presenters talked about it yesterday. It is essential and fundamental to be able to function as a human being, and certainly to be able to navigate and manage tinnitus and to be able to use these techniques that we talk about with patients in a way that's going to be beneficial. If you're not getting sleep, everything else is more challenging to deal with. We know that lack of sleep is tied with increase in anxiety. It makes you more irritable and more frustrated. So if sleep is reported, as we're framing out working with a patient, it's a primary focus area for us to work on. So we're talking about sleep hygiene and reviewing their sleep routine. What things are they doing leading up to bed? What are they doing if they wake up in the middle of the night? What are we doing in the morning time when they first wake up relative to their sleep, relative to their tinnitus? So going over tools and techniques to improve sleep. We're talking about sound therapy options for sleep. You'll see the sleep headband. I don't know if anybody's using something like that or a sound pillow. There's lots of different options for sound therapy for nighttime, sleep apps that sort of do guided meditation or sleep stories to help with kind of calming that nervous system down prior to going to sleep to help facilitate falling asleep and staying asleep. We're talking about evaluating and ruling out underlying medical issues that might be related to those sleep issues. So if there's sleep apnea or some other physiological underlying cause that may be a factor in poor sleep, we want to make sure that that's addressed too, because that is contributing to not getting enough sleep to help with that tinnitus management. And then for those who really have severe sleep issues, sort of what would be really diagnosed as insomnia, there is a program, CBTI, so cognitive behavioral therapy, specifically designed for insomnia. There are web-based programs, there are self-guided programs, and then certainly you can work in person or via telehealth with someone who specializes in this area. And we will make referrals for that if that seems to be, sleep is a significant issue that's affecting the patient's overall comprehensive plan. The third, and I think, again, significant contributing factor to being able to manage through the stages of tinnitus habituation, the third pillar is stress reduction. So I talk a lot with my patients in the beginning about the concept of the window of tolerance. I'm not sure, some of you have probably heard this or are familiar with this if you have a background in psychology, but the idea is that, we all kind of function in this general window. We all have this optimal window where we feel self-regulated, we feel grounded, we feel calm, our nervous system is feeling at peace. And there is fluctuations within that window of tolerance, not that there's not sort of these stressors, but we're able to kind of get ourselves, grounded again to stay within that optimal window. Now, when there's significant stress or a significant traumatic event, our nervous system is thrown completely out of whack, right? It goes haywire. And we go way out of that window of tolerance. We either go to a state of hyperarousal, which is that fight or flight phase, which is characterized by anxiety, panic attacks, sort of feeling overwhelmed. Our nervous system is hyperactive, right? Or we go into hypoarousal, which is the freeze response, where we feel kind of shut down, we feel depressed, we feel exhausted. And this, one of these two states, either hyperarousal or hypoarousal, are really common in the acute onset phase with tinnitus or sound sensitivity. Our system is thrown out of whack, it's totally overwhelmed. So a lot of the things that we work with patients on, particularly related to this pillar, is how do we get ourselves back into that optimal window? And if we can get ourselves back into this optimal window, we know that that will help with supplementing tinnitus habituation. Another big part of stress reduction is to address how our thoughts and our feelings affect our behaviors and actions related to the tinnitus. So CBT, by now you guys are all experts in CBT. By definition, it's the type of treatment that helps people learn how to identify and change the destructive or disturbing thought patterns that have a negative influence on our behavior and our emotions. The goal of CBT is to be able to learn how to identify those automatic negative thoughts. I mean, they pop into our head before we even realize we're having them, right? It's something that's automatic. And then through practice, which it takes a lot of practice and work, to be able to build like skill and capacity around being able to identify those thoughts, sort of challenge those thoughts, and to be able to replace them or reframe them. You'll hear the term or see the term cognitive restructuring a lot related to CBT, to be able to change to more objective, realistic, neutral thoughts related to the tinnitus. So if we can break this cycle that happens related to the tinnitus, then we also know that our overall stress level is going to go down. That helps us get us back into that optimal window of tolerance. And then this negative cycle, this negative feedback loop that we talk about a lot with our patients, you hear the tinnitus, there's this fear response that happens, the feeling or the thoughts or emotions, feeling anxious or worried or angry, frustrated, manifests in mental or emotional and physiological stress reactions, which make us only more aware of the tinnitus and more bothered. And then that cycle goes round and round and round. So in addition to CBT, it's also really important to, under this pillar, to talk about and come up with the different stress management or stress reduction techniques that are going to work for each individual person. So I've listed a few, progressive muscle relaxation, guided breathing, going for a walk outdoors, spending quality time with friends and family. And this is really individual to each person. Spending quality time with friends and family might be the best thing for one person, and for another person, that might cause a significant amount of stress. So it's really about actually identifying, which five stress management reduction techniques actually are going to work for you. We recommend, having it written out, having a visible list, like post it on your fridge, post it on your bathroom mirror, have it readily available and visible. So when you're starting to feel stressed and overwhelmed, instead of going into that freeze or fight or flight mode, it's like, all right, I have these 5 things. I'm going to pick one of these things and do them now. And it's about not only that, but becoming aware through training and education and working one-on-one with our providers or with any specialist in this area on kind of being strategic and proactive about becoming aware of this build of stress and anxiety prior to you getting to that overwhelm point. So instead of being reactive with these things, when your system's already out of whack, you're already feeling completely overwhelmed by everything, to be able to sort of start to identify the signs when that stress is starting to build up and be super proactive about implementing those strategies consistently on a daily basis as part of your comprehensive treatment plan. We know that if we can sort of dial it back and identify, okay, I'm starting to feel, my breath rate's feeling shallow, my thoughts are starting to spin, all of these things, there's signs, right? And it's about becoming aware of those things and implementing the techniques that are going to work to bring that nervous system back down to feeling regulated prior to things getting out of control. And then the fourth pillar is somatosensory. So this is the one that, I'm sure doctors, if you go to see a primary care or ENT for the most part, and you mentioned, tinnitus, I doubt that this is even brought up as a question. But somatosensory or somatic component to your tinnitus is a subtype of tinnitus that is associated with activation of the somatosensory, somatomotor, and visual motor systems. So a key characteristic of this subtype of tinnitus is that it's modulated. You can modulate it by physical contact or movement. And apologies, this graphic is a little bit fuzzy, but you'll see the percentage of tinnitus modulation by somatic region. So the majority of patients who we work with who have a somatic component, it's related to the temporomandibular joint or the jaw muscles and the head and neck, so upper cervical spine. Although I've had patients that I've worked with over the years who are able to modulate their tinnitus with eye movement or eye gaze, or actual movement of their arms or legs. So there's lots of different body networks that are involved in the somatosensory component, and it plays a big part in overall treatment plan. So if that is something that somebody has, it has to be addressed too. Research shows that 35 to 40% of tinnitus patients report a somatic component to their tinnitus. The treatment recommendations and referral to specialists depends, on the anatomic location of the somatic input. So if it's jaw related, we're referring to a dentist or a TMJ specialist. If it's upper cervical spine, potentially referral to PT or a physical therapist who specializes or focuses on that area to be able to help with realignment or reduce tension, whatever the issue is that's contributing to that tinnitus signal. And again, just as like a general statement, everything's connected. So if we're feeling super stressed and tense, anything we can do as part of that stress reduction strategy or pillar to kind of keep the entire system relaxed as possible is going to help with any somatic component as well. And then just to show you, this is a very scaled down, simplified version of the central auditory pathways, but essentially there's research studies that show and can verify that, we have our peripheral auditory system, so our outer, middle, and inner ear, and then all these nuclei along the central auditory pathway up to the auditory cortex or the auditory part of of the brain. And then there's also this other network called the somatosensory network that feeds certain neural firings or neural activity from this particular system feed into a specific nuclei in the central auditory pathway. So for those who have somatic tinnitus, there's this extra neural firing when there's already hyperactivity in the auditory pathway. The somatic piece, there's extra neural firing that feeds into this particular part of the auditory pathway, which then exacerbates that tinnitus. So we know that for those who have a somatosensory component, addressing that will likely help to reduce just the overall intensity of the tinnitus. It's not typically a cure-all, but it's part of the treatment plan. And again, framing it out and understanding which areas to focus on. For those who have a somatosensory component, it's a primary area of focus.